Hello, my name is Joshua Honrado, and in partial fulfillment of the requirements for the degree Doctor of Athletic Training, I am presenting my applied research project on the epidemiology of dance-related injuries presenting to emergency departments in the United States, 2014 to 2018. I would like to take this time to thank my ARP advisor, Dr. Lamb, as well as Dr. Bay, and all their help with this ARP. First, let's go through some background. Structured dance provides suitable requirements to fulfill global health benefit recommendations on the amount of moderate to vigorous intensity physical activity, MVPA, humans should obtain while within multiple age groups. For the purposes of this project, I am defining structured dance to include any various style of dance taught by a dance teacher or a dance piece performed in front of an audience. As a fun and creative way of satisfying MVPA, dance is enjoyed by many. Dedicated high volume and high intensity dance training starts at a relatively young age for those seeking careers in dance. The high physical demand of dance training places the human body at increased risk of injury, with injuries occurring most commonly as a result of systematic overload involving the lower extremity and back. While these injuries may cause pain or discomfort, injuries tend to be ignored by dancers due to the development of high pain tolerances and the familiarity of performing in pain, without taking into consideration potential consequences for the dancer's future well-being. What does current dance injury epidemiology tell us? Recent findings among professional ballet dancers found 1.06 for male and 1.46 for female injuries per 1,000 dance hours. Furthermore, when compared to other genres of dance, ballet is associated with a higher proportion of overuse injuries than acute injuries. While these findings provide insight into dance injuries that are managed by on-site healthcare providers, such as athletic trainers and physical therapists, little is known about those injuries occurring at sites without a healthcare provider. One way to gain a better understanding of dance-related injuries not managed by on-site healthcare providers is to investigate data reported by emergency departments, or EDs. For example, from 2000 to 2013, it was reported that approximately 17,000 dance-related injuries presented to EDs in the U.S. every year. An increase of 33.4% for total number of dance-related injuries from 2000 to 2013 suggests that dance-related injuries are becoming a frequently managed injury in EDs. Although these findings provide initial insight to dance-related injuries reporting to EDs in the US, there has yet to be updated data since 2013. Thus, the purpose of this study is to describe the rates and patterns associated with dance-related injuries reporting to EDs between 2014 to 2018. In October of 2019, data was extracted from the National Electronic Injury Surveillance System, NEISS, which consists of de-identified, publicly available, nationally representative patient data collected from a probability sample of 100 EDs located in the US. The NEISS is operated by the Consumer Product Safety Commission at the following web URL. All data were entered by hospital staff and reviewed by a facility NEISS coordinator at each hospital. The NEISS coordinator abstracted pertinent data from selected ED records and transcribed them in coded form onto a NEISS coding sheet using rules described in the NEISS coding manual. Previous studies have used the NEISS database to describe social health issues and provide preventative health measures for targeted populations. Data from the NEISS have been shown to be accurate and reliable for description of non-fatal injuries in the US. Within this study, data was obtained on all dance-related injuries, product code 3278, for all people who presented to an NEISS participating hospital from January 1, 2014 to December 31, 2018. Data was also extracted on all ages, sex, body parts, diagnosis and disposition or outcome of presentation, and free text regarding the mechanism and nature of the injury. In order to truly define our sample and distinguish true dance-related injuries, only injuries that occur during structured dance events, such as dance class, dance competition, dance school, dance practice, or injuries which mention specific dance terminology, such as style of dance, dance motion, dance clothing, dance equipment, were included. Injuries occurring during unstructured events, such as dancing at a conference, at a wedding, or in the club, were excluded. Each patient case was associated with a weight to provide national estimates. Descriptive statistics, frequencies, percentages, were utilized to summarize counts, percentages, and rates across patient cases. For incidence rates calculations, U.S. population estimates for males and females were abstracted from the U.S. Census Bureau from 2014 to 2018 by age group. Incidence rates were calculated as the number of cases per 100,000 people. Looking at the results, injury demographics are summarized in the following table. Most injuries occurred in females and among those who were 10 to 18 years old. Almost all patients were treated and released, and a small percentage were admitted to the hospital or left the ED before being seen by a healthcare provider. Injuries occurred most commonly at the knee, ankle, and foot, and were diagnosed as sprain or strain, fracture, and contusion. When considering diagnosis by body area, as seen on this slide, the most common injuries were ankle sprain or strain and knee sprain or strain. Cross-tabulating diagnosis with sex, similar percentages of diagnosis were found amongst both sexes, except males had more fractures than females, and males had fewer sprain than females. Looking at the data from a wider lens, the first major point I want to highlight is that during the years 2014 to 2018, there was an overall increase in dance-related injuries presenting to US EDs. A population-weighted estimate of 125,618 structured dance-related injuries reported to EDs during the study period, with an increasing trend over time of 19.2% increase over the 5 years. In conjunction with previous research, these findings suggest that over the past 20 years, there is a continual rise of dance-related injuries being seen within US EDs, with no clear indication of a decline. It is known that there is a growth in the number of dance studios and hence a growing population of dancers, but the 19.2% increase in injuries reporting to EDs during this study period surpasses the 3.1% growth of the dance studio industry seen between the years 2014 to 2019. The second point I want to highlight is not a surprising one. Similar to previous dance epidemiology, most dance-related injuries reporting to EDs were within the lower extremity and consisted of sprains or strains. It is unclear from the data whether these injuries are acute or chronic in nature. With a high prevalence of chronic injuries seen within previous dance epidemiology, this chronic nature leads to instances of time lost from activity, affecting a dancer's ability to rehearse or perform for an extended period of time. So though this isn't surprising, it is still a significant finding. The third point I want to highlight, which is surprising, is that our findings show that the vast majority of patients reporting to EDs with dance-related injuries were relatively young at 10 to 18 years old, 76%, and female, 83.3%. Furthermore, incidence rates suggest that females are over 4 times more likely to suffer a dance-related injury than males. 12.4 compared to 3.0. Previous dance epidemiology has indicated that the incidence of injury among amateur ballet dancers was 0.99 for male and 1.09 for female dance injuries per 1,000 dance hours. Similar results have been reported For professional ballet dancers, with an incidence of injury 1.06 for males and 1.46 for females. Thus, our reporting of higher incidence of injuries in females than males by a factor of 4 is greater than the almost 1-to-1 incidence of injury reported with previous dance epidemiology. This indicates that there is a potential reason as to why female dancers are 4 times more likely than their male dancer counterparts to seek health care from EDs. Studies have previously shown that women in general do utilize medical care services more than men. Within this study, this may potentially be due to differences in health perceptions and the reporting of symptoms and illnesses, or a greater likelihood that women seek help for prevention and illness compared to men. I would like to lastly highlight the finding that almost all patients within this study were treated and released, 97.1%, and only a small percentage were admitted to the hospital, 1.6%, or even left the ED before being seen by a healthcare provider, 1%. With 97.1% of these injuries being treated with conservative care, this places a huge cost burden on the dancer patient. These injuries could have potentially been treated and managed by on-site healthcare practitioners such as athletic trainers, reducing the burden these injuries might be placing on EDs, as well as providing more immediate and cost-effective treatment for dancers. Research indicates that athletes at secondary schools with medical teams, including athletic trainers, sustain lower incidence of injuries than athletes in schools without athletic trainers. There has been an increase in athletic training services within the college, university, and professional dance programs, but it is unclear whether these services are being offered to pre-professional dance students. As the major age group which reports EDs, an increase in access to proper medical services such as athletic training and injury prevention education should be provided to pre-professional dance students. Using a retrospective cross-sectional study design, there are inherent flaws and limitations to this study. Similar to this photo, we only have viewing access to parts without viewing the whole. One major limitation is the inability to analyze the exact behaviors or reasoning as to why these dancers decided to go to the ED as opposed to seeking alternate healthcare. These data do not indicate whether alternate healthcare services were available to the dancer or if these dancers first sought conservative care prior to the ED visit. Due to the lack of patient-reported outcomes or follow-up after the ED encounter, another limitation to this study is that we were not able to determine cause and effect based on the results of this study. In addition, we were not able to determine an exact reason as to why dance-related injuries reporting to EDs increased between 2014 and 2018. Lastly, another limitation to this study design is that the population obtained is not guaranteed to be representative. Coding of the NEISS data was quality checked by an NEISS coordinator, but the inclusion and exclusion criteria of injuries related to true technical structured dance activities were not established by the NEISS coordinators. This may lead to a misrepresentation of this population if NEISS coordinators were unable to classify structured dance injuries, or if unstructured dance injuries were not excluded from the study, such as the conference dancer from a previous slide. In summary, our findings suggest that dance-related injuries reporting to EDs increased over a 5-year period, 2014 to 2018. The majority of dancers were female, between the ages 10 to 18. Nearly half of the patients reported to the ED with a sprain or strain, and almost all patients were treated and released. Future investigations should aim to better understand the role on-site healthcare providers, such as athletic trainers, play in managing these patient cases within these specific populations to help address global healthcare concerns, including overall demands and costs. Thank you for your time and your attention. If you have any questions about this ARP, feel free to email me at the below email address. For those interested in the reference for the study, the following slides display these references.